And about a month later, I had her back in for her biometry and her topography, and I was just shocked at the change in both magnitude and meridian. Yeah, I'm Dr. Blake Williamson from the Williamson Eye Center in Baton Rouge, Louisiana. We are a generational practice, so we've been around 75 years in our market. It was started by my grandfather 75 years ago. He had 4 sons, they all went into ophthalmology, and so now I'm the 3rd generation. We have 5 different centers. We have an in-house ASC, we have a cosmetic surgery center as well. We have 4 surgeons, we have 8 optometrists, and 125 employees. Specialized really in high volume, state-of-the-art refractive cataract surgery, LASIK, and also microinvasive glaucoma surgery in dry eye. Anytime that we're looking at a new drug or a new device or a new anything really, we think about 3 different things or value to us. It's unmet need, value add, and work involved. So is there something in our practice that we already have that we can do, treat whatever disease it is already? Or if not, then there's an unmet need there. Is there a value add? What's this going to do for the patient? Are we being reimbursed for this? We can't do things for free, naturally. And then the last thing is work involved. What do we have to do in order to incorporate this technology into our practice? If it fits these 3 modalities, then it's something that we look at very closely. So we all know that dry eye disease is like the diabetes of eye care. It kind of permeates everything. It can mess up everything. It can, your refractive outcomes, you name it. It opens up for infections on the eye. If you have epithelial breakdown, there's all kinds of different ways that dry eye can affect that. So the ability to treat dry eye disease, specifically recalcitrant dry eye that maybe you've already tried artificial tears, maybe you've already tried immunomodulation, all these things, with a wet amniotic graft has been transformational for the ocular surface of many of our patients, specifically those patients that we are speaking to about premium IOLs and who desire spectacle freedom after surgery. So when I first started in practice, I started with Procara because this is what I had heard about. This is what I knew other KOLs and people that I look up to as mentors were using and had great results. I did encounter some discomfort with patients as well. So I tried some of the dry amniotic grafts as well, but the results just weren't nearly the same. To me, I had a couple instances where the patients didn't do nearly as well as I hoped they would. So I kind of migrated back towards Procara, especially in patients who are, again, getting prepped for refractive cataract surgery. So my wow moment with the Procara device basically was a really sweet patient, 65-year-old grandma, and her passion in life was to go see her grandson play travel baseball. That's all she wanted to do. But she was a +4 hyperope, and she had some astigmatism as well. So she wanted spectacle independence. She wanted to be able to go to those games and cheer on her grandson. But I'm looking at her topography, and on the axial maps, it looks a little irregular. And I said, So I go back and look closely at the slit lamp, and I stain the cornea, and I noticed that she has some EBMD, which I didn't even pick up before. It's very subtle. So this is a patient that I positioned for a superficial keratectomy. So I was able to do a superficial keratectomy, and then afterwards place the Procara, let her epithelium heal beautifully. And about a month later, I had her back in for her biometry and her topography, and I was just shocked at the change in both magnitude and meridian of her astigmatism. So by doing the Procara, I was actually able to stabilize her cornea and give her that toric implant that she wanted, and now she can go to ball games and see her grandson play. She's one of our happiest patients. Every time she comes in, she brings us a cake to my staff, and she's been a joy. So that was really my wow moment that kind of pushed me over the edge. This is something that's game-changing for our patients.